National Rural Health Mission, or NRHM in short, and National Urban Health Mission. The importance of health is recognized in the process of economic and social development. This development improves quality of life. Hence, the Government of India has resolved to launch the National Rural Health Mission. In this audio essay, we will look into all the details of this scheme. It may be noted that this is an important essay from examination point of view, and hence the detailed discussion is necessary. The National Rural Health Mission relates to health in terms of nutrition, sanitation, hygiene, and safe drinking water. It also aims at mainstreaming the Indian systems of medicine to facilitate health care. The goal of the mission is to avail health care in rural areas, the poor, women and children. The framework of the implementation of the National Rural Health Mission was approved by the Union Cabinet. This implementation targets 18 states with weak public health indicators. Thus, the mission has foreseen 5 core strategies. They are: 1. Increasing participation and ownership by the community. There is an increased public participation in hospital development committees and district health planning. Likewise, the role of programs such as ASHA has increased. There is a greater space for non-government organization participations, that is NGOs. Second, improved management capacity. The core of this is professionalizing the management system in the rural health sector. This is built by public health skills management at workforces. Decentralization in management and public participation play an important role in improving management capacity. Third is flexible financing. The central strategy of this is the provision of untied funds to every level. The levels include village health and sanitation committees, public health care and district hospitals. Janani Suraksha Yojana is one example of the demand side of financing option for the effective public health system. Fourth is the innovations in human resources development for the health sector. This ensures adequate recruitment for the public health system. The most important outcome is the dramatic increase of nursing staff. The core strategy is the expansion of professional and technical education among weaker sections. Number 5. Setting up of standards and norms with monitoring. The standard is prescribed based on the primary health norms. There is a facility survey which identifies gaps and supports monitoring. For example, drug supply gap is monitored by drug procurement and distribution policy. Apart from the above, the acceptors of the family welfare method showed 50 lakh sterilization and 56 lakh intrauterine device, that is IUD insertions in 2011 as against 50 lakh sterilization and 57 lakh intrauterine insertions in 2010. It shows that the intrauterine device family planning method has constantly getting reduced in the last decade. Government claims good progress under National Rural Health Mission in various areas. Some of the details are, for example, infrastructure strengthening. There have been new constructions in 20,000 facilities, and there also have been renovations of 19,000 facilities, and they include upgradation in the sub-centers, primary health centers, etc. There are 8,000 primary health centers which are functional. Around 2,000 health facilities also exist as a first referral units. The second aspect is the augmentation of human resources. Several lakh human resources include several thousand doctors, specialists, Ayush doctors, staff nurses, paramedical staff, all have strengthened the healthcare delivery system in the country. The third aspect is mobile medical units and emergency response services. Around 400 districts have been equipped with mobile medical units. These units are operational in 2012 all across the country. The fourth aspect is the Community Health Development Program. Nearly for 7 lakh people, government claims that the program of ASHA, spelt as ASHA, has provided a drug kit. Nearly 30,000 Rogi Kalyana Samitis were constituted at health facilities. Lakhs of villages, health and nutrition days were launched under this mission. Approximately 8 lakh people have been trained and engaged in the entire country under this ASHA scheme. Fifth aspect is the mainstreaming of Ayush, spelt as AYUSH. Around 10,000 Ayush doctors and 4,000 Ayush paramedical have been added in the progress. Approximately 15,000 facilities have been claimed to have been established as a part of the Ayush program. In addition to the above, the proposed National Urban Health Mission also aims to address the public health care needs of the urban population. This investment includes health professionals, appropriate technology, and utilization of existing infrastructure. Dealing with urban health problem is the thrust area for the 12th 5-year plan. This urban mission ensures partnership with community for involvement in planning, implementation, and monitoring of health services. For example, partnership with NGOs and charitable hospitals are the main features here. It also ensures two-tier system of risk pooling like Women's Mahila Arogya Samiti to fulfill urgent hard cash needs for the treatments and a health insurance scheme for enabling urban poor to meet medical treatment needs. One of the important components of the National Urban Health Mission is strengthening the disease control program. Now let us discuss the steps taken by the government to achieve the target of polio eradication as a part of this. All states and union territories in the countries have developed a rapid response team. They respond to any polio outbreak in the country. An emergency preparedness and response plan have been developed by all the states. Special booths have been established in areas bordering neighboring countries, for example, Wagah border and Atari train stations in Punjab. They ensure that all the children under 5 years of age crossing the border are given polio drops. This is extended to the migrant population as well. An extremely high level of vigilance of polio virus circulation has been maintained. In 2012, environmental surveillance also was established. Government of India has identified 107 high-risk blocks for polio. A multi-strategy is implemented to ensure sanitation, hygiene, and clean drinking water in addition to vaccinating each and every child with oral polio vaccine. Finally, the social mobilization activities are being intensified by involving the local influencers, community, and religious leaders. In this context, there is one more important program called Pradhana Mantri Swasthya Suraksha Yojana. This Yojana aims at correcting the imbalances in the availability of affordable healthcare facilities in the different parts of the country. The phase of the Yojana has two components. One, the setting up of All India Institute of Medical Science-like institutions in important places in the country. Second, upgradation of 13 existing government medical college institutions. This Yojana has decided to set up 6 All India Institute of Medical Sciences, that is AIIMS, one each in the states of Bihar, Chhattisgarh, Madhya Pradesh, Orissa, Rajasthan and Uttaranchal. Nearly 800 crore rupees have been sanctioned for this purpose. The key points to remember in this essay are: National Rural Health Mission foreseen 5 core strategies like increasing participation and ownership by the community, improved management capacity, flexible financing, innovations in human resources development for the health sector, and setting up of standards and norms with the monitoring. The progress under National Rural Health Mission have been seen in the infrastructure strengthening, augmentation of human resources, mobile medical units and emergency response services, and also communitization and mainstreaming of alternative medical system called Ayush, AYUSH. Recognizing the seriousness of the urban health problem also, the Urban Rural Health Mission also has been taken as a thrust area in the 12th five-year plan. Several social mobilizations have been created as a part of the mission to strengthen disease control programs. The successful implementation of Yojana, it is hoped, to result affordable health care facilities in the country. Ayush, that is, an alternative health system, is an important health mission and it is financially and medically supported by the National Rural Health Mission.